Hello everyone, welcome to my webinar on the topic of osteoporosis and factors and the remedies. And it also comprises of how the coffee and tea impact on the bones. Let's start it. This is showing that how that our bone is constituent of the 10% bone cells, 20 60% calcium and phosphate crystalline hydroxyapatite, 30% organic matrix, that is type 1 collagen. So the cell consisting of bone forming cells, that is osteoclast cells, that is bone forming cells, and osteoclast cells, that bone resorbing cells that remove the old bone and the damaged bone. Now, what is the osteoporosis? How it happened? When the imbalance between this osteoblast cells and the osteoclast cells happens, it led to the osteoporosis. Another thing we are going to discuss is osteoporosis. It is a chronic bone disease caused by the imbalance between the bone formation and the resorption, that is bone dissolving, that is done by the osteoclast cells, resulting in a bone mineral loss and a microstructure deterioration. We know that our bone is consists of microporous structure, and in osteoporotic bone, we can see this porous structure enhanced. Here, the pores are very small, and there is a big pores that's showing that the how the bone loss and the mineral density of the bone decreasing with the age and led to the deterioration that places the bone at the risk of fracture and the bone defects. Another is the normal joint. Here we check that the normal joint is like this is a normal joint and this is a damaged joint, and we can see this space indicating the damage, and this is completely filled with the cartilage which indicate the normal joint, and there is a bone loss starting with the age, and this known as a osteoporosis. With the increasing of age, tearing of joint occur, and most commonly this occur in the people above the age of 55. Another thing we are going to discuss is about how tea and coffee affecting the bone density. Increase what happen when we take the excessive tea and coffee. As we know that the tea and coffee consist of caffeine that increases the urinary calcium excretion and decreases the resorption of calcium in the intestine, inhibits the proliferation of osteoblast cells, that is a bone forming cells, and bone healing process, that is osteogenesis, leading to elevated risk of fractures. Coffee drinking on affects the calcium phosphate balance and led to the bone disorders including osteoporosis. Compounds of coffee, especially caffeine, impair the calcium absorption and stimulate the calcium excretion. There we can see that this is urine, and on intake of caffeine led to the release of calcium from the urine. This is the osteoblast cells, and excessive intake of caffeine led to inhibit the osteoblast differentiation. These cells differentiate to form the new bone, and this impaired the osteoblast differentiation and led to bone loss. Now, the role of oxidative process in the osteoporosis. We can see that role of oxidative stress is one of the risk factor of osteoporosis, and the imbalance between the free radical production and the antioxidant capacity may cause the oxidative stress, and this oxidative stress led to the pathogenesis of the various chronic diseases. Radical in an atom or a molecule with a single unpaired electron, for example, superoxide anion, hydroxyl radical, lipo, lipoperoxide radical. In this process, free radicals seize electron from the lipids in the cell membrane. The reactive oxygen species or reactive nitrogen species, including peroxynitrite, nitric monoxide, and nitric dioxide, are the radicals produced in vivo. That is, in vivo means in human body. Oxidative stress may induce osteoporosis through the increase in expression of cytokines, that intracellular chemical messengers in the bone. The resorption of the bone by the oxidative stress undergoes through the activation of nuclear factor K beta protein, which is the crucial mediator of tumor necrosis, factor alpha, and osteoclastogenetic, means bone resorbing restriction, and led to the osteoporosis. So this is the effect that what the oxidative stress led to the osteoporosis. Now the role of antioxidants against the osteoporosis. Antioxidants are the protective against the oxidative stress and are the potential to reduce the risk of osteoporosis. Antioxidants contribute to activating the differentiation of osteoblasts, mineralization, and reduction in the osteoclast activity. Vitamin C, E, D are the antioxidant. As a primary antioxidant, vitamin C is able to remove reactive oxygen species, then decreases the oxidative stress, because this oxidative stress led to the osteoporosis, which related to osteoporosis, and low intake of this vitamin C can reduce the bone mass, greater rate of bone loss, and increase fracture. The supplementation of vitamin C may provide changes regarding improvement in oxidative stress and bone mineral density. Citrus fruits examples are where we get this vitamin C, that is from the citrus fruits, pepper, kiwi fruit, as well as cabbage, broccoli, kale, or tomatoes. Another is vitamin E. It is a free radical scavenger, and deficiency of vitamin E impairs the calcium transport via intestine and reduce bone density. Almonds, sunflower seeds, papaya, and dried apricot. Vitamin D, necessary for calcium absorption and bone metabolism. Deficiency of vitamin D can accelerate the bone loss, increase bone turnover, osteoporosis, and fracture found in some food sources including eggs, meat, seafood, salmon, tuna, sardines, herrings, mushrooms, and dairy products. How to curb the osteoporosis in elderly people? First and the main thing is vitamin D. If the vitamin D is less than the 3 to 347 international units, the people are at the high risk of hip and knee osteoporosis and osteoarthritis. Osteoarthritis comprises of loss of cartilage with the aging. So, and osteoporosis is loss of bone. Avoid excessive tea and coffee, which led to the drainage of calcium in the urination due to the presence of caffeine. Proper good sleep is required because depression led to the joint degradation. So these are the main things that we can follow and curb the osteoporosis in the elderly people. Thank you. So this is our today webinar, and thank you guys for listening.